Good morning to you all. Today my class will be on the oculomotor nerve. So I will be taking the oculomotor nerve under the following headings. First is the introduction, then we have the functional components of the oculomotor nerve, then the deep origin, then superficial origin, course, relations and distribution of the nerve, then the ciliary ganglion, branches of ciliary ganglion, and about the applied anatomy. So coming to the introduction, the oculomotor nerve is the third cranial nerve. By now you must be knowing that there are 12 pairs of cranial nerve. The third cranial nerve is known as the oculomotor nerve. So it supplies all the extraocular muscles except the superior rectus and the superior oblique and the lateral rectus. Its connection with the ciliary ganglion supplies also two more smooth muscle, that is the sphincter pupillae and the ciliaris muscle. Coming to the functional components. So if you learn any cranial nerve, you need to know about the functional components of the nerve. So here the functional component of the nerve is mainly we have two. Number one, we have the general somatic efferent. Number one, we have general somatic efferent. So what do you mean by general somatic efferent fiber? So general somatic efferent fiber, they supplies the smooth muscle, the skeletal muscle which are attached to the body wall. So what are the skeletal muscle here in this case? They are the extraocular muscle. So the general somatic efferent fibers for the extraocular muscles, right. So here the extraocular muscles are, so I have told you that the oculomotor nerve supplies all the extraocular muscle except superior oblique and lateral rectus. So here we have the superior rectus, then we have the inferior rectus, then we have medial rectus, levator palpebrae superioris, then we have the inferior oblique. So these are the extraocular muscles supplied by the oculomotor nerve. So this is the general somatic efferent fiber. Secondly, we have general visceral efferent. So what do you mean by general visceral efferent? So here please remember the word visceral, that means the smooth muscles, okay. So here in this case the smooth muscles, they are the sphincter pupillae and the ciliaris muscle. Okay, so we have first general somatic efferent and the general visceral efferent fiber. Then lastly we have proprioceptive efferent fibers from the extraocular muscle, that means the proprioceptive fibers from which is given out by the extraocular muscles. So these are the functional components. So you need to remember general somatic efferent and general visceral efferent and why they are for, what is the function of that. Next, coming to the deep origin. What is the deep origin of the muscle? Here the deep origin here, you need to remember the nucleus. So here in this case the nucleus of the oculomotor nerve, we call it as the oculomotor nuclear complex. Oculomotor nuclear complex. It is the combination of what I just told, general somatic efferent fiber and the general visceral efferent columns. So where is this deep origin located? So this deep origin is located in the midbrain. So the midbrain, we have studied the level of the midbrain at, the cut section of the midbrain at two levels, that is first at the superior colliculus superior colliculus, and secondly at the level of inferior colliculus. So, by now we know that the oculomotor nuclear complex is located in the grey matter of the midbrain at the level of the superior colliculus. So, where exactly is this nucleus located? So, if we see this picture, so this is the cross section of the midbrain at the level of superior colliculus. So, here we have the aqueduct, this is the grey matter and this is the white matter. So, if we divide this part, this is known as the tectum, this is the tegmentum, and here you have the substantia nigra, and this is known as the crus cerebri. Okay. So, the deep origin here is located on the grey matter. On which part of the grey matter? On the ventromedial part of the grey matter we can see the oculomotor nuclear complex. So, here is the oculomotor nucleus complex, because there are many positions for different types of nucleus, like we have the dorsolateral nucleus, we have the intermediate nucleus and etc. So, it is known as the nuclear complex. Laterally, this oculomotor nuclear complex is bounded by the medial longitudinal fasciculi. So, here in the deep origin you need to remember two things. First one is that the oculomotor nuclear complex, which is located on the midbrain at the level of the superior colliculus. Where exactly on the midbrain? At the grey matter, on the ventromedial part of the grey matter. It is bounded laterally by the medial longitudinal fasciculus. Just posterior to it, you will find one more nucleus, that is known as the Edinger-Westphal nucleus. So, this is located just on the posterior part of the oculomotor nuclear complex. So, why do we call it as a complex? Because it has got different segments. So, what are the segments? First, we have the dorsolateral segment here, dorsolateral. So, we call it as dorsolateral segment. Then we have the intermediate segment, or we call it as the intermediate nucleus. Next, we have the ventromedial. After ventromedial, we have the caudal central. So, this is the caudal central. Next to just above the caudal central, we have the median raphe. So, this we call it as median raphe. Similarly, on the other side we have ventromedial, then we have the intermediate nucleus, then we have the dorsolateral nucleus. Lastly, we have seen that just posterior to the nucleus we have got the Edinger-Westphal nucleus. So, here we will have the Edinger-Westphal nucleus. This is the Edinger-Westphal nucleus. So, what are these nucleus for? These are specific for each muscle, like the dorsolateral is specific for your inferior rectus, intermediate nucleus is specific for your inferior oblique, ventromedial is specific for your medial rectus muscle, caudal central is specific for your levator palpebrae superioris, median raphe median raphe is for your superior rectus. Edinger-Westphal nucleus. So, we have seen that Edinger-Westphal nucleus through the ciliary ganglion, it supplies the two muscle, that is the sphincter pupillae and the ciliaris muscle. So, if we draw the eyeball here, so here is the pupil. So, here your sphincter pupillae muscle will be located here. Sphincter pupillae muscle will be located, and somewhere here the ciliaris muscle will be located. Ciliaris muscle will be located. So, this Edinger-Westphal nucleus gives off preganglionic fiber here. The ciliary ganglion is located here. So, the post ganglionic parasympathetic fiber goes and supplies the ciliaris muscle here and also the sphincter pupillae. So, this is the preganglionic, this is post ganglionic, and here we have got the ciliary ganglion. So, this is about the deep origin of the oculomotor nerve. Coming to the superior origin. What is the superior origin of the oculomotor nerve? So, we have to come out from the nucleus. So, the location of the nucleus is clear. So, what about the superior origin? Once it comes out from the grey matter, we have already seen that this part of the midbrain is known as the tegmentum. So, it passes laterally through the tegmentum. This red color rounded part is known as the red nucleus. It intersects the red nucleus, then passes on the medial side. This blackish part is known as the substantia nigra. Then it passes through the medial part of the substantia nigra, then appears in the posterior part of the interpeduncular fossa. So, this is about the superior origin of the oculomotor nerve. I repeat again, after the deep origin, it comes forward and appears in the tegmentum, passes laterally forward and appears in the tegmentum of the midbrain, intersects the red nucleus, then it appears in the medial part of the substantia nigra and also in the posterior part of the interpeduncular fossa. So, this is the superior origin of a superficial origin of the oculomotor nerve. Next, coming to the course and relation. So, coming to the course and relation, we have seen till here that it appears in the posterior part of the interpeduncular fossa, isn't it? So, after that we will be studying the course. After it appears in the interpeduncular fossa, it passes forward in the interpeduncular cistern, and it appears between the posterior cerebral artery and the superior cerebellar artery. So, here in this picture we can clearly see that the oculomotor nerve after passing forward appears in the interpeduncular fossa here. After it appears in the interpeduncular fossa, it passes between this is the superior cerebellar artery and the posterior cerebral artery. So, the nerve appears here and passes between the posterior cerebral and the superior cerebellar artery. what happens after that? Then it accompanies the lateral side of the posterior communicating artery, pierces the arachnoid matter and appears in a triangular area of dura mater in front of the crossing of the fixed and the free margin of the tentorium cerebelli. We need not confuse here. What it means is, after it passes from the interpeduncular fossa, it passes forward in between the two artery, that is the posterior cerebral artery and the superior cerebellar artery. After it passes between these arteries, we can see the posterior communicating artery here. So, we can clearly see that it lies lateral to the posterior communicating artery. So, the nerve here, the oculomotor nerve, lies lateral to the posterior communicating artery. Just after that, it pierces the arachnoid mater and lies lateral to the posterior clinoid process. So, let me just show you what do you mean by the posterior clinoid process. So, here we can see the pons. So, we can see the oculomotor nerve here, the course of the oculomotor nerve here, this part here, this part here is the sphenoid bone. So, here we can see, here what are the things we can see? We can see the posterior clinoid process, the oculomotor nerve here is lying just lateral to the posterior clinoid process, then it lies on the lateral part of the cavernous sinus. The cavernous sinus is lying somewhere here. Then it passes through the superior, if you see a foramen here, it passes through the superior orbital fissure. So, here this is the sphenoid here. So, here we can see the pointed, we can see two pointed part, one is anterior and one is posterior. The anterior one is known as the anterior clinoid process. The posterior pointed part here just behind the foramen, just behind a fossa, the fossa is known as the sphenoidal sinus. Just posterior to that we call it as the posterior clinoid process. So, the oculomotor nerve passes just lateral to that. So, same thing you can see, this is the posterior clinoid process here. Then after it passes through the lateral to the posterior clinoid process, it appears in the lateral wall of the cavernous sinus. So, it appears in the lateral wall of the cavernous sinus here, passes forward within the lateral wall of the cavernous sinus. Once it passes to the cavernous sinus, you need to remember certain relation, that is, it is related to two more cranial nerves. They are the fourth cranial nerve, we call it as the trochlear nerve, and the ophthalmic and the maxillary division of the trigeminal nerve, that is the fifth cranial nerve. This ophthalmic and the maxillary nerve, they are the branches of the fifth cranial nerve. So, at the cavernous sinus, they are related to the oculomotor nerve is related to two more nerve, that is the trochlear nerve, then the trigeminal nerve. Which branch of trigeminal nerve? That is the ophthalmic and the maxillary division of the trigeminal nerve. So, I hope you all can see here. I think it was seen better in the other picture. See here, this is the oculomotor nerve. It is related to, as I have told, two more nerves on the lateral side of the on the lateral wall of the cavernous sinus. Number 1, that is this maxillary nerve. Number 2, we have the ophthalmic nerve. So, they all lie lateral and below the oculomotor nerve. So, here it is medial and above, just lateral, and below we have the ophthalmic division of the trigeminal nerve. Lateral to that we have the trochlear nerve, below that we have the maxillary division of the trigeminal nerve. So, these are the relation on the lateral wall of the cavernous sinus. So, after the cavernous sinus, we see that the nerve has to proceed anteriorly, means anteriorly forward to reach the orbit to supply the extraocular muscles. So, what it does is, on the anterior part of cavernous sinus, it divides into superior and the inferior rami. After it divides into superior and the inferior rami, it appears into the superior orbital fissure within the tendinous ring. So, here you can see we have the cavernous sinus here. From the on the anterior part of the cavernous sinus, it will divide into superior. This is the superior rami and this is the inferior rami. It passes through the superior orbital fissure. The superior orbital fissure is divided into 3 compartments by a tendinous ring present here. So, the oculomotor nerve passes through the tendinous ring. In between the two rami, one more nerve appears, which we call it as the nasociliary nerve. So, the nasociliary nerve intervenes between the two rami of the oculomotor nerve. Next is the distribution of the nerve. So, after the cavernous sinus, we have the superior orbital fissure. In the superior orbital fissure, 2 ramis of the oculomotor nerve are present. First is the superior rami and the second one we call it as the inferior rami. So, what does this superior ramus supply? The superior ramus So, if you see the picture here, we can see this dotted part here, this is the superior ramus. What it does is the superior ramus passes forward, appears into the orbit and it supplies 2 muscles. First one is the levator palpebrae superioris and the second one is the superior rectus. So, these 2 nerves, these 2 muscles are supplied by the superior ramus. Next we have the inferior ramus. This inferior ramus has got, it divides into 3 branches. One which passes medially below the optic nerve, it supplies the medial rectus. The second one which supplies directly to the inferior rectus, and the third one supplies the inferior oblique, and it provides a communicating branch to the ciliary ganglion, through which supplies the sphincter pupillae and the ciliaris muscle. So, we have seen the superior ramus, isn't it? Next we have the inferior ramus. So, this is the inferior ramus here. This inferior ramus divides into 3 branches. The first branch will go medially. So, this is the first branch which is going medially, it supplies the medial rectus. The second branch goes to the inferior, the second branch goes to the inferior oblique, inferior rectus, to the inferior rectus, and the third branch goes to the inferior oblique. So, this third branch which goes to the inferior oblique, it provides a communicating branch to the ciliary ganglion, through which it supplies the sphincter pupillae and the ciliaris muscle. So, let us go to the distribution again. So, the first we have, so we will see this distribution just about after the superior orbital fissure. So, here we have got the superior orbital fissure. From here it is divided into 2 ramus. First is the superior ramus and second one is the inferior ramus. This is inferior ramus, this is the superior ramus. Then we have got our extraocular muscles. They are, we have got the levator palpebrae superioris, then we have got the superior rectus here. So, this is the levator palpebrae superioris, this is the superior rectus. Here we will have the lateral rectus, here we will have the medial rectus, then below we will have the this is the inferior rectus and this is the inferior oblique. So, first we will see about the superior ramus. This passes anteriorly forward and supplies the levator palpebrae superioris and the superior rectus. Next we have our inferior ramus. This inferior ramus gives off 3 branches. The first branch goes medially and supplies the medial rectus. The second branch goes below and supplies the inferior rectus, and this third branch goes and supplies the inferior oblique. So, the nerve to the inferior oblique gives off one more